Hi, we are group 2 and we are doing our presentation on stress, lifestyle, health, and biopsychology. We're going to first start off with the impacts on the immune system, the physiological connection between stress and illness. Stress could be seen as a process in which a person senses and responds to circumstances that they view as overwhelming or threatening to their welfare. According to Psychology Second Edition, the immune system has various structures, cells, and mechanisms that protect the body from foreign substances that can damage the body's tissues and organs. When our immune system is weakened by the chronic stress, it cannot fight off infections, illness, and diseases. The hypothalamic pituitary adrenal axis is a complex system that regulates the body's response to stress. Prolonged stress levels overstimulate this system, and increased cortisol not only disrupts the HPA axis, but also weakens the immune system. The HPA axis is made up of three organs: the hypothalamus, anterior pituitary gland, adrenal gland. Stress hormones that derive from the HPA axis are produced when we encounter stress. Cortisol, epinephrine, and norepinephrine are all hormones that the HPA axis produces during stressful times. We can develop long-term stress-related illnesses, which are a weakened immune systems, high blood pressure, depression, PTSD, and progression on a variety of physical illnesses and diseases, morbidity, and mortality. So this list is not exhaustive. There are other illnesses, of course, that can occur when we have a weakened immune system.
Psychosocial factors. The main psychosocial factors that influence stress and illness are work relationships and social dynamics and early life experiences. The factors these factors cause stress and influence your well-being by how your body reacts to it, how you perceive it, and how you cope with it. Body reactions. Stress hormones such as cortisol and adrenaline are released, which can also trigger a fight or flight response, which raises heart rate, blood pressure, and glucose levels. Perception. A person who struggles with low self esteem may see things differently and more overwhelmingly, which activates the body's stress response. Coping. People may choose unhealthy coping strategies such as smoking, drinking, and overeating, and social isolation, which can lead to increased risk of disease and stress. Factors and their effects. Social dynamics cause stress, worsen the immune system, and cause long-term mental health problems. Work. High workloads, difficult deadlines, and lack of control can cause stress, increasing the risk of anxiety and depression. Early life experience like abuse, neglect, and household issues as a child are commonly linked to long-term stress and illness. Relationships, parental and marital issues can cause a strain on one's mental health and add stress.
Depression and anxiety are very similar health problems that occur often together. If you're depressed, like you are very sad and like you lose interest and also like you have no energy to do anything. And anxiety is a little bit different. It's more of like worrying more and it's also physical tension. And there was a research in 2021 that was found that if you had like depression, it was 6 times more likely to have anxiety as well. And this research was shown all over countries and it was shown all over ages as well. And both of these disorders share symptoms like fatigue, sleeping problems, difficulty concentrating. which makes this diagnosis challenging. There are some treatments available for these symptoms, such as behavior therapy and selective certain reuptake inhibitors. Finding and treating these conditions help people like get better. So in the long term, you won't have long-term problems. And this is important. So make sure you guys go check with your doctors. So if you guys have these conditions.
Stress management involves adopting a healthy lifestyle and using relaxation techniques to reduce the negative effects of stress. In some cases, professional therapy or counseling services provide extra tools. Stress management not only calms the mind but also protects long term health. Stress therapy can help people manage stressful feelings, situations, and even cope with them to help reduce stress levels. Different types of stress therapy include cognitive behavioral therapy, which is a type of therapy that focuses on connections between thoughts, feelings, emotions, making changes, and the outcomes of the changes. Psychodynamic therapy explores a person's past experiences, emotions, and its connection to their current mindset. Mindfulness based cognitive therapy focuses on the internal thoughts and feelings in the external environment. Benefits of therapy include enhanced physical health, builds coping skills, improves relationships, and helps with focus and productivity. Lifestyle changes can make a huge difference in reducing and managing stress. These include meditating, eating a well balanced diet, and getting physical activity. Practicing these small changes can keep your stress in check.